third year of medical school, I traveled home to Nigeria for vacation. My parents, proud as ever, told their friends, "Our doctor is home, come for a free checkup." I wasn't even a doctor, but people came. Among them was a young pregnant woman. She just wanted me to check her blood pressure. But what I found changed everything. Her blood pressure was dangerously high. I asked her a few more questions as to if her urine was foamy, and she said yes. A foamy urine can be a sign of protein in the urine. So it became clear to me that she was showing signs of preeclampsia. Now, she already had a doctor managing her pregnancy, but when she told him her urine was foamy, all he said was drink more water. I sent her back immediately and I told her, "Tell your doctor you may have preeclampsia." When she arrived at the hospital, they realized the mistake. She was admitted immediately, placed on strict monitoring and bed rest to give her child a chance to survive. A simple blood pressure check in my parents' living room saved her life and that of her child. Now that girl is a 12-year-old, she's intelligent and she'll change the world. But here's the reality. Not every woman gets that second chance. This week is Black Maternal Health Week, and today I want to talk about Black maternal health, not just as a statistics, but as a global reality. Across the world, Black women are significantly more likely to die from pregnancy-related causes than women of other races. In the United States, Black women are 3 times more likely to die from maternal causes than white women. In the United Kingdom, they are 3.7 times more likely. In Brazil, the risk is 5 times higher for African descent women. This is not a coincidence, it is a pattern. And globally, African countries carry a disproportionate burden of maternal deaths, accounting for 70% of maternal deaths worldwide. Nigeria accounts for only 3% of the world population, yet it contributes to nearly 30% of global maternal deaths. Think about that. In Nigeria, 1 in every 22 women is at risk of dying from pregnancy-related causes in her lifetime. This statistics is terrifying. Many of these deaths are linked to conditions we know very well: high blood pressure, diabetes, pregnancy complications like hemorrhage, and infections. But here's the truth. 80% of these maternal deaths are preventable. So the question becomes, why are they still happening? The answer goes beyond medicine. It includes lack of healthcare infrastructure, racial disparities, limited access to quality care, shortage of trained medical personnel, inadequate government investment in healthcare, and systems that are simply not prepared to respond to emergencies. These are not just gaps, they are failures that cost lives. Prevention must start at every level. Stronger health systems, early detection and management of chronic diseases, health education and lifestyle changes, and most importantly, equitable care for every woman. Because no woman should be at higher risk simply because of who she is, her race or geographical location. Progress is possible, but it requires intention. Black maternal health is not just women's issue, it's a public health issue, it's a justice issue, it's a human issue. Because behind every statistic is a mother, a family, a story that should not have ended. We need governments who are ready to invest in healthcare systems and actually show that they care for their people.